Welcome to MS Research Australia's Research Report. I'm Dr. Hamish Campbell, and in this series we explore the research that's going on in Australia and around the world. In this episode, we meet Associate Professor Tony Hughes. He's developing a small molecule which potentially may help treat MS by encouraging the repair of the insulating layer on nerve cells called myelin. Here he is explaining his research.
Our project is looking at trying to develop a small molecule that we could use to treat multiple sclerosis. And this small molecule is based on one of the body's own molecules called brain-derived neurotrophic factor. And basically we've taken this large protein and made a small fragment of it and chemically constrained it to make a sort of mini version of BDNF. And we're examining that for its ability to maybe treat multiple sclerosis. So what we're doing is taking this small molecule fragment that we've made and designed and seeing if it can then talk to cells in the nervous system or in a damaged nervous system and get cells to remyelinate the nerve cells, and that is to put an insulating sheath back on the nerve cells. And it's this insulating sheath which is lost as part of the disease of multiple sclerosis. With our most recent findings from this project, we've been able to show that our small molecule that we've designed can reverse the loss of myelin in a laboratory model of multiple sclerosis. So that's actually really exciting. And what that tells us is that this is a brand new way, potentially, to treat multiple sclerosis. And it's exciting, particularly because it is able to reverse, or may be able to reverse, the loss of myelin that you see as part of the progression of multiple sclerosis. So many of the symptoms of multiple sclerosis come about because of this loss of myelin, loss of the insulation that sits around our nerve fibres. And as a result of that, the nerves don't fire properly. If we can replace that insulating sheath, which our compound can do in this laboratory model, then in principle you may be able to get the nerve cells to fire normally again, and that would simply negate many of the symptoms that you would see with multiple sclerosis. It's really about reversing the progress of the disease. So it's really important to note that although this work's exciting, it's still preclinical work, and there's going to be some period of time before we can translate this into a treatment for human multiple sclerosis. The compound that we have at the moment, the molecule that we have at the moment, itself is not going to be optimally suited for use as a drug, and part of our project with MS Research Australia is to develop a compound that's better suited for use as a drug. And generally speaking, when you've got that compound, it takes about 10 years to translate that from a laboratory finding into a drug that can be used in humans. There are a series of challenges in taking a lead compound through to a compound that could be used to treat MS in humans. Importantly, the chemical has to get into the brain of the patients, has to get into the central nervous system of the patient. Our current compound doesn't do that, so part of our work is to try and come up with modified versions of the compound that are better able to access a patient's brain where the damage is taking place in multiple sclerosis. The other thing, of course, that's important is to show that the compound is safe to use. At the moment in our laboratory studies, it appears to be safe, but that's something that you have to continue to show that it's going to be safe to use in patients. And of course, the final barrier is actually showing that what happens in the laboratory actually works in humans. The models that we use to study the disease are not the same as a human with multiple sclerosis, and that's often the intangible big barrier. So there are two main things that we're looking at in this project. The first of these is to try and devise modified versions of the molecule that we have at the moment, which would better able to access the brain and have their action on the damaged parts of the nervous system in multiple sclerosis. The second part is to take our current compound and new ones that we devise and look at them in other laboratories of multiple sclerosis. And generally speaking, you need to show that compounds are active in a range of models before you've got sufficient evidence to move into the critical human clinical trials. So our plan for that then is to come up with these new molecules determine their activity in the laboratory models of MS, and then we'd need to partner with a larger organisation, maybe a biotechnology or pharmaceutical company, in order to take the compounds through the final stages of preclinical development and ultimately then into human trials. So this project actually had its roots in the previous century when a PhD student of mine designed a small compound that was able to mimic the action of this protein called brain-derived neurotrophic factor. And we've had this molecule floating around in the lab, drifting in and out of different projects. And it was really some chance meetings with Simon Murray and Junhua Xiao in the Department of Anatomy here at Melbourne University, who are interested in multiple sclerosis research, that got us together testing that compound in multiple sclerosis laboratory models. It's been with us for about 20 years to get to this stage, and sometimes that's how science works. You have to be patient, but also prepared for the unusual connections that might happen. So my lab is a small one, which I run in conjunction with Susan Northfield, who's a senior postdoc in the lab. We have about 6 people in the group, but really important for us is our external collaborations with other scientists. And those are the things that allow us to expand our core technology, which is the design and synthesis of these small molecules, and expand that into the areas of biology that allow us to look at a disease such as multiple sclerosis.
Now that's a brief snapshot of Associate Professor Hughes' work. For more information, go to our website and make sure you like us on Facebook and subscribe to our YouTube channel for future research reports. I'm Dr. Hamish Campbell, and I'll see you next time.